This is part 3 of non-Medicare health plan rating methodology for the San Francisco Health Service System and Health Service Board, the historical perspective on SFHSS health plan rating relationships across plans and tiers. This discussion provides information to the Health Service Board of the San Francisco Health Service System as well as other interested parties regarding how health plan rates are set for SFHSS health plans for active employee and early retiree populations, also known as the non-Medicare populations. My name is Mike Clark, lead actuary for AON, in the work that we do for the Health Service Board and the San Francisco Health Service System. This was recorded in early April 2020. This discussion has emerged to address periodic questions raised by Health Service Board members, as well as in public comments during HSB meetings about the relationship of health plan rates across active employees versus early retirees within a plan, by dependent coverage tier, single, two-party, and family within a plan, and across health plans offered by SFHSS. As reviewed in parts 1 and 2, this is the end state of our calculations, the 2020 monthly rates and contributions for the 5 health plans offered by SFHSS, the 3 dependent coverage tiers within each health plan, for 2 major population segments, active employees and early retirees. There are multiple employer contribution determination rules within each segment, including by employer for active employees, where this particular chart illustrates for the City County of San Francisco employer, and for retirees, where this chart illustrates a full employer contribution for retirees who have earned that. We previously reviewed in parts 1 and 2 how AON for self-funded and flex-funded plans and the health plans for fully insured plans perform rate-setting activities for next year's health plan rate recommendations, and how total cost rates are segmented into employer and member contributions for both the active employees and the retirees. This part 3 will address the historical perspective on SFHSS health plan rate relationships across health plans and dependent coverage tiers, given the historical influence that has on current methodologies. And then our conclusion in part 4 will focus on the current state of SFHSS health plan rate relationships across the health plans and dependent coverage tiers. So let's begin part 3, historical perspective on SFHSS health plan rating relationships across plans and tiers. How plans have historically treated the dependent rate add-ons by plan differ between the Blue Shield and Kaiser plans and the UHC self-funded PPO plan, also known as City Plan. In the first bullet, you'll see that for the insured plans, historically, the dependent rate add-on has had the same dollar value for dependents for active employees and early retirees. For the Blue Shield HMO plan, which is now known as Access Plus, in 2013, this plan was migrated from full insurance to flex funding. And in this year of migration in 2013, the plan maintained this element of rating in its first year of flex funding, where the same dollar value for the rate add-on for dependents applied for both active employees and early retirees. For Kaiser's insured HMO plan, this has existed for many years, and this practice of the same dependent dollar add-on for active employees and early retirees continues today. This contrasts with the UHC City Plan, where for active employees and early retirees, they have had historically similar rate ratios applied to the determination of rates for dependent tiers for active employees and early retirees. This means a greater spread in the dollar value for the dependent portion of UHC PPO plan rates for early retirees than for early retiree dependents in the Blue Shield and Kaiser plans. This chart illustrates the 2013 plan year rates, again presented for historical context as it leads up to what we'll discuss in Part 4 for present state rating. You will see in this chart that the dollar increment in rates is the same between active employees and early retirees for the Blue Shield and Kaiser plans, but not for the UHC City plan. In this table, you will see blue bands with red text illustrating the dependent rate increment on a dollar basis, focusing for Blue Shield Access Plus and Kaiser HMO, how the figures are the same in each dependent coverage tier between the active employees and early retirees. As an example, for Blue Shield Access Plus, the dependent add-on dollar value is $645.15 for the first dependent for both active employees and early retirees. In contrast, for the UHC PPO City plan, you'll see that the rate ratios are approximately the same when you compare retiree plus one or employee plus one rates to the single tier, and the same for the retiree plus two or more or employee plus two or more to the single tier. As an example, 1.965 is the total rate ratio from employee plus one to employee only, which is nearly identical to the 1.97 ratio used to compare retiree plus one to retiree only. This existed in rating methodology, even though the dependents of the early retirees are older and generally higher in cost than the dependents of active employees for the Blue Shield and Kaiser plans. The other key observation from 2013 rating is the active versus early retiree rating spread difference between the UHC PPO City plan and the other plans. Again, highlighted in the blue shading and red text in this chart. The relatively small gap in employee-only tier and retiree-only tier rates for the UHC PPO City plan versus the other plans means there is much less of an actuarial difference dollar amount in the city charter guided employer contribution formula that we reviewed in Part 2 versus that for the Blue Shield and Kaiser plans. And you'll see at the bottom of this chart the actuarial difference, which is the retiree only rate for a plan minus the employee only rate for a plan, is a much greater figure for the Blue Shield Access Plus plan than it is for the UHC PPO City plan, with the Kaiser HMO actuarial difference falling in between. So in summary, two key rating methodology differences existed historically between the UHC PPO City plan and the Blue Shield and Kaiser plans. The first was the treatment of dependent rate add-on beyond the employee-only and retiree-only tier for the dependent tiers plus one and plus two or more by plan. The UHC PPO City plan used a proportional ratio approach. The Blue Shield and Kaiser plans used the same dollar value approach. And the second key differential was in the rating treatment between active employee only and early retiree only by plan, again known as the actuarial difference in the city charter employer contribution formula for retirees. The UHC PPO City plan has a smaller ratio approach where the retiree only rate was 1.16 times the employee only rate, which was influenced by adverse selection present in the active employees who elect the UHC PPO City plan, compared to, for the Blue Shield and Kaiser plans, a much larger ratio in comparing retiree-only rates to employee-only rates, a 2.2 times ratio for Blue Shield and a 2.0 times ratio for the Kaiser HMOs. These differences largely continue today, as we'll discuss in Part 4. This concludes our Part 3 presentation.